Lance, cataract surgery has really changed over the past 30 years and things have really advanced, but tell us a little bit about where things have come from in your experience over the past 30 years or so.
It really has changed a lot. I remember the days when we were making incisions that were as big as the eyeball with 6 weeks recovery, and that changed a lot with phacoemulsification, as you notice. And we've gotten it down to the small incisions now that virtually have limited astigmatism. But now with the new advent of the laser cataract surgery, we can be more accurate than I ever dreamed we could be.
We'd really like to just take a moment to thank you for trusting us with your eyes, and your optometrist for sending you up our way. We really want to give each patient the very best outcome we can, and that starts with technology and it ends with execution.
The accuracy of these new systems boggles your mind. I've probably done close to 60,000 procedures in 30 years, and like it or not, it does it better than I can do it. When Dr. Wirtz and I design a cataract procedure for you that's a refractive cataract procedure, we may use all or part or some or none of the laser cataract technology. And I can say honestly, were I to have my surgery tomorrow, I would lay down and I would have Catalyst laser refractive surgery for my eye. It's gentler, it reduces the energy, and it's reproducible so we can tune in the fine elements one needs to be able to see well without glasses. Haven't you found that?
Absolutely. I think in my experience, I was maybe a little skeptical. I thought, I can do this better than this laser.
Right.
And I've really found that this tool is something that far exceeded my expectations.
I think it's important as you consider laser cataract surgery to also think a little bit about the difference between the laser and manual techniques. For example, when we're using the manual technique, we use a needle and forceps to manually pull the capsule rhexis, or the opening in the capsule, around. While Dr. Ferguson and myself are both experts in this technique, no human hand is quite as good as the laser. And so with the laser, we're getting almost a cookie cutter perfect circle every single time. We want the lens to really sit in the center of the eye, and that provides a better refractive outcome for you. With the laser, we're able to image the cataract, and with that imaging, we're able to better line up the lenses. Again, while the manual technique is good, we feel the laser is a little bit better. And for patients with astigmatism, we want to use the laser because of the precision, image-guided cuts that the laser can make. They're so much more precise and so much more predictable than the manual technique. We feel like that's just another advantage for you. When it comes time to actually remove the cataract, we want to make sure that the cataract is as soft as possible. Now, some people wait longer and they have a very dense cataract, and in those cases, we really feel like the laser makes a big difference because the laser energy can actually soften the cataract before we even go in to remove it, and that decreases the overall energy that's used and can speed your recovery.
Probably 96% of our patients are on the money just with the simple Catalyst procedure. However, some, because their cornea is abnormal or there's some other issues, they may need what we call an enhancement. And the enhancement is the excimer laser, and that's included. The very few that actually come to actually have that are shocked. They say, "You mean I don't have to pay for this?" I say, "No, you don't have to pay for this. That's our commitment to you. Our goal is to get you to see at distance without correction to do the majority of your tasks." And that's different for different individuals. The Catalyst, like everything else, is a tool. And what the components that we use on one patient, we may not use on another patient. So we try to optimize that patient's chance of success. And it's just, if you saw this and it were 100 years ago, you'd think it was magic. Although Catalyst laser refractive surgery has many benefits, it still carries some risk with the procedure, and these will really need to be discussed with you preoperatively.
While we know there's a lot of benefits to laser refractive cataract surgery, it's not covered by insurance. So you'll be speaking with a counselor in just a few minutes to discuss financing options.
I became an ophthalmologist because I really enjoy extending quality of life to patients. I know we don't always just save lives, but sometimes enhancing quality of life really adds quality to people's years.
And that dovetails really nicely with our mission statement, Gary. Our mission statement is simply to improve the quality of patients' lives through our commitment to surgical excellence and patient-centered co-management. In fact, we're really the only eye care practice that I know of that eye care is not specifically mentioned in our mission statement. Our focus is solely on the quality of your life.
I just really want to say once again, thank you so much for allowing us to participate in your care. We want you to achieve the same visual results that you want, along with your primary care optometrist back home. So thank you so much.
My name is Jim Rocco, and I've come to Dr. Lance Ferguson for cataract surgery. My obstetrician, Karen McMillan, has been following my cataracts for about 8 years, and she said, now it's time to go. I came in last Friday and had my surgery. The results of the surgery were fantastic as far as I was concerned, because as I looked out of my new eye, which I'll call it, to the colors, they were so vibrant and bright that I didn't really think I needed cataract surgery until that happened. And now I'm anxious to get my left one done so I can see the colors as perfect as it should be. Thank you very much to all the folks here at the Commonwealth Eye Surgery facility for being so nice and taking care of me.
I recently had eye surgery, cataract surgery on my right eye at Commonwealth Eye Surgery Center, and I would highly recommend anyone to come, even my closest family member. Everything has been great prior to this surgery. I had had 3 other surgeries, so I was ready for my vision to come back, and within 4 weeks of surgery here, I am now going to get new glasses to now be able to correct my vision and see probably 20/20, and I would recommend it to anyone.
Well, Commonwealth Eye Surgery doctors, Dr. Lance Ferguson and Dr. Gary Wirtz, along with clinic optometrists, surgical and clinical staffing, are opening their doors to assist in visual restoration for 13 pre-qualified surgeries on Sunday.
Wow, cataract workups and 26 cataract extractions are being donated to improve these patients' quality of life through surgical excellence. Dr. Ferguson and Dr. Wirtz are here to tell us about this event. It means so much when they have the cloudy vision from cataracts, and then all of a sudden, after this, and the patches come off, they're seeing things so sharp.
We've got the best job in the world.
Yeah.
It's so much fun.
Yeah.
People are blind, and the next day they're like puppy dogs.
Yes.
It's so much fun. Well, this group that we are actually getting associated with is the Surgery on Sunday group, started by Andy Moore.
Fantastic organization.
It really is, and they've provided so much care, and so we're getting all these accolades, but really with these individuals, Andy Moore and Health South Surgery Center, that really got this thing started, Dan Rodas and Joyce Dickin and those people. We had a couple nurses, Stacy Beard, who worked there on Sundays, and said, can we do something? And we said, well, yeah, we can do something.
Yeah.
Since I've got my new partner here, Dr. Gary Wirtz, we're so lucky to have him, a talented surgeon, and he's all ramped up to help us out here in this case.
Absolutely. We're just excited, honestly, to be able to have the opportunity to help people who really otherwise wouldn't have a chance to have cataract surgery.
Now, here's the thing with Surgery on Sunday. You guys correct me if I'm wrong, but the organization is seeking out people who are in a situation that they kind of fall between the cracks, where they don't really get government assistance, but they can't afford insurance.
Right.
So they're in that in-between area, and that's where you guys step in, right?
Yeah, and for the whole program, not just eye care.
Yeah.
But the eye care is so much more technical. We can't do surgery on Sundays, so we're doing surgery on Sunday on Friday.
Oh, I
so
see.
we had to work them out because of the measurements of the intraocular lenses and the specifics of this, rather than say herniorrhaphy. So with those people, asking us to do it, we said we're more than happy to do it. And it's not just us. It was, Carissa Burt Skeeters that basically orchestrated this. We got Alcon and Bosch and Loam. We got the huge cater of optometrists to provide post-op care.
Stepped up. Yeah.
For their post-op care the following day or with us, whatever's convenient for them. And Danville Anesthesia Associates, those people are donating their services. All our staff are working free of charge. It really, we added it all up. It was more than 6 figures.
I'm sure.
And we like to do this. We think that this is a perfect example of showing how we can step up to the plate and take care of the donut. The people that fall through the hole.
Now, you've already selected these individuals. Can you tell us, without being too detailed, the degree of the loss of vision? Are we talking about people who are really, really on that I can't see, or
actually, I started at Southland Christian Church, the Refuge Clinic, and we started seeing patients who just needed eyeglasses, for free. And during that process, we were able to identify a number of these patients who were going to be helping. And so I actually have seen some of these folks, and these are people who literally, in some cases, have to be led in by the hand. They cannot even see to walk around. And so, it just breaks our heart. We live in a community. We, have access to good care. When you see someone who cannot literally walk around without bumping into things.
And you can fix it.
And you can fix it. You have the opportunity to fix it.
you know, it just takes a little bit of logistics with other folks, like Dr. Ferguson has mentioned. We just have all come together, and like I said, it's a team approach. We're just so excited to be able to help these people, though, and get them, you know, get them where they can see again.
As Lee would say, they're counting buildings at 1 foot.
Yeah,
Right.
exactly.
Right.
Yes.
So it'll be a life changer for them.
Hey, the kid's pretty good, isn't he?
I'll tell you what, I better keep practicing. He's really good.
Hey, now for more information, you can call these guys, 859-224-2655, or log on to CommonwealthEyes.com.
Because
Guys,
Dr.
thanks for
Ferguson,
doing the
you've
work.
taught a lot of people
Oh,
this
yeah.
skill, so you've got your skill too. All right, well, let's take a quick break.
Yep, we'll continue with more LAX 18 News at 12:30 coming up in just a moment.
Welcome to Eye on LASIK. We're talking to Dr. Lance S. Ferguson, Surgical Director of Commonwealth Eye Surgery. He'll be answering commonly asked questions about LASIK eye surgery. Why Dr. Lance Ferguson and Commonwealth Eye Surgery?
That's a good question. And the answer lies in our core values. And simply put, they're safety, accuracy, and integrity. We need to be able to look you in the eye and assure you that we have spared no expense in ensuring your safety for this procedure. Whether it's a tracking device, a suction limiting device, an algorithm checker, a backup power supply, the latest software, we can look you straight in the eye and assure you that you will go nowhere to find any better safety profile than we offer you at Commonwealth. Accuracy comes from several sources. The first is accurate preoperative evaluation, in which we check your visual acuity and your refraction multiple times. Then we process this data through a computer to make sure any little changes are made prior to your treatment pattern. The second is we have a system set up where one individual will enter the data, one individual will check it, and then I will personally check it prior to your treatment. That's 3 checks to make sure no errors are made. The third is our technology, and our technology, the flying spot laser, vastly surpasses the accuracy of the earlier broad beam lasers. And the fourth is me. I'm an obsessive compulsive type, and I may be a bad roommate, but I'm a good surgeon. A criticism of modern medicine is that the technology allows surgeons to do so many wonderful procedures that they tend to forget about the patient and the patient's need in the process. Sometimes they push the envelope and apply these modalities to people that are not good candidates. One needs to curb their enthusiasm and put themselves in the patient's place. And most importantly, the surgeon has to be able to tell a patient no.
This has been Eye on LASIK, brought to you by Commonwealth Eye Surgery. Call or click to get more information or schedule your free consultation.
For the past 10 years of my life, I have been unable to do anything without wearing either corrective lenses or contact lenses. And so at the recommendation of a friend, I went to Commonwealth Eye Surgery and was evaluated for LASIK. They told me that I would be a perfect candidate, so I elected to have it done. The surgery procedure was as smooth as it could possibly be. Everyone here was great from start to finish, and now I can finally wake up in the morning, get up and go, not have to worry about putting on glasses, contacts, or anything like that. And it's been one of the best medical experiences I've had in my entire life. So thank you to the staff and crew here at Commonwealth Eye Surgery. I really appreciate all the great work that you guys have done.
Hello, I am Larkin. I am just about 6 or 7 months out from my surgery, my LASIK that I had in January. Just came from the exam room. I have 20/15 vision, which I'm not sure what my vision was before the surgery, but I know it was nowhere close to 2015. I could barely read a license plate without glasses. So I'm so thrilled with the results of my surgery. Sometimes I wake up and freak out and think that I still have contacts in, but I don't. I just have perfect vision without them. I wake up every day and get ready for work or do whatever I'm doing in everyday life, and I see perfectly, which I think I took for granted, you know, just being able to get up and go, but it's absolutely amazing not having to worry about it. Everybody here has been more than helpful and more than willing to answer any of my stupid questions, so I'm so thankful for them and everybody at Commonwealth Eye Surgery, and thrilled with my results and very thankful for everyone that helped me get here.